Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the Pharmacy Practice Regulation 2015. What is the Pharmacy Practice Regulation 2015? This is the practice of pharmacy, interpretation, evaluation, implementation of medical orders, dispensing of the prescriptions, drug orders, dispensing, compounding and administration of drug, participation in a drug and device selection and drug related research, patient counseling, patient care and pharmaceutical care. Patient counseling, oral communication by pharmacist to the patient or caregiver to inform about proper use of drug and drug devices. Pharmaceutical care, pharmaceutical-centered practice in which pharmacist assumes responsibility for a patient drug-related need and help in prevention, elimination or reduction of patient symptoms or disease. Pharmacy practitioners, an individual currently licensed, registered or the authorized under the Pharmacy Act to counsel or administer drug to the patient. Community pharmacist supplies prescription medicines and provides the advice and the information on the people health. Hospital pharmacist dispensing of drug to patient and advise them about medicine. Pharmacy practitioner, next is the clinical pharmacist, provide patient care that optimize the use of the medication and promotes health, wellness and disease prevention. They work in the collaboration with the physician and other healthcare professionals. Next is the drug information pharmacist, provide the information and advice regarding drug interactions, side effects, dosage and proper medication to patient and other health professionals. Next is the code of pharmacy ethics. Patient care is the first concern of the pharmacist. Second, honest and trustworthy. Be responsible for the colleague and other health professionals. Upgrade the professional knowledge and become the competence, respect and just support patients individually and dignity and confidentially. And maintain the patient record, does not engage with illegal or unethical conduct that will discredit the profession. Rent or lease of pharmacy registration certificate is strictly prohibited. Displaying the name of owner and registered pharmacist. Name of the registered pharmacist is displayed at the main entrance of the premises and building. A registered pharmacist may display his or her name on signboard along with the educational qualification, registration number and photograph. And the pharmacist during working time should wear a white clean the apron. The bandage plate consists of name and registration number of pharmacist. Next is the duties and responsibilities of pharmacist. Provide of healthcare education, pharmaceutical care, formulator, distributor, compounding of medicines, post-effective health therapy, safe and rational use of drug, and patient counseling. So in today's class, I discuss about the code of pharmacy, ethics, and also about the pharmacy practice. What is the pharmacy practice regulation 2015? Thank you for watching.